My name is Justin Droessler. I'm from Dickeyville, Wisconsin, and I'm a senior here at Clarke, and as well as that, I'm also a first-year DPT student. My undergrad was in psychology, and then this year I'm focusing on my graduate school for doctorate of physical therapy, and then finishing up my biology minor.
My name is Savanna Edson, and I'm in Clarke's Doctor of Physical Therapy program, and I'm going to graduate in 2021. I'll tell you a little bit about myself. I completed my undergrad back in Washington State at Eastern Washington University. I got my bachelor's of science with a major in exercise science and a minor in psychology. When I was applying for grad school, I used PTCast, where I just kind of looked at all the possible PT programs and looked at which ones met my prereqs, and I applied to 5 different schools, and I kind of narrowed it down between Clarke, which I was accepted to, and then a program in St. Louis, Missouri, which I was waitlisted, and I decided to come to Clarke just for financial reasons, and also I looked into the program and the mission statement, and it kind of aligned with my values and what I wanted to get out of a PT program.
Within my undergraduate experience, I participated in track and field, so I was a member of that, and then also I got the opportunity to work in the cadaver lab, which is something that's very unique to Clarke because we have so many cadavers for the amount of students that we have. And so in my sophomore year, I got to take anatomy and physiology in there, and that was a full year course, which I really liked. And then also I've been working as a TA in there ever since then. And then this year, as a first year PT student, we get to dissect the cadavers. So that's a super cool learning experience to be able to combine what you're learning in lecture and then to be able to find that in the cadavers and then make those connections that way. The main reasons I chose Clarke is because when I first came as a senior in high school, I just really loved the atmosphere that it gave and the way the professors acted, the way other people that work here acted. It's just a really good, close-knit family that really makes you feel at home like as soon as you walk through the doors. Being that Clarke has a 3+3 program, it really sparked my interest because it saves you a whole year of schooling. So you have 3 years undergrad and then you go right into grad school and you have 3 years of that, where normally you would have 4 years and then 3 years of graduate school. That's one of the main reasons I came here. It helped that I loved the atmosphere at Clarke, but being able to save that year while still getting the necessary schooling was really important to me. Technically this is my senior year, so I still get to compete in athletics, which is super cool to be able to still do that 4th year and use that eligibility. It is an adjustment, but again, you're still working towards that goal. And one thing at Clarke is that the coaches are very understanding of you being in a sport, and so they're going to be able to give you some time off if you need it for school, but then in the same time, your professors are still going to be able to adjust to your sports as well because they understand the opposite of that. We had to have at least 30 hours of physical therapy observation coming into Clarke to be able to apply to the program, and it helped me to really look at the places that I was at and realize like this is really what I want to do, and to be able to picture yourself in the same situations and to want to help those patients, it really kind of gives you a good idea of what you're working towards when you come here.
My first year of PT school, what I feel like was definitely the most challenging year, just going from the adjustment from undergrad to grad and just the demands and expectations of everything. Going into the second year, you're starting to learn more of those hands-on skills. Year 3, we're expected to know everything to pass the board's exam, but when we go into our clinicals, we are expected to take full patient caseload. So
going forward in my 2nd and 3rd year, I'm going to be learning more neurologic stuff. I'll have 2 internships during my 2nd year, and then my last semester, my 3rd year, is 2 8-week internships. You're going to be able to apply what you're learning going forward, and it's going to be a process, and when you get to the end, you're going to be an entry-level ready therapist. The first internship that we have is focused on like inpatient, so working with people that might have a knee replacement or that are in the hospital, and then also outpatient, so patients that are coming to the clinic for something maybe later after they had a surgery. They're not throwing you into them super difficult cases that you wouldn't know what to do, but they're giving you those cases to be able to use what you're learning at the stage that you're at.
Originally, coming into grad school, I thought I was going to be very like outpatient based, orthopedic based, but the more time I have spent in my neuro class, and my last 2 clinicals were at skilled nursing facilities, which I would have never imagined myself in a skilled nursing facility, but the more time I got to work with medically complex patients and neuro patients, I have been drawn to that challenge. just working with them and being able to help patients who really have severe deficits or problems, and then just learning more about them in class and being able to implement those skills and see patients' progress has kind of driven me to go more towards neuro, and I'm just more interested in that field now.
Also, that's unique to Clarke is we have a practicum program, and so what this is for first and second year students that are in the DPT program, and we work with patients at Clarke. Some patients come to us, and then we also go out into the community and provide our services to them, but they're also giving back to us because we're using it as a learning tool, and yet they're still getting therapy out of that. So it's kind of a dual threat there, you could say. Seeing patients the second semester of your first year seems pretty overwhelming at first, but you learn pretty quickly that being able to apply what you're learning is very helpful. And then as you go into your first internship over the summer, you already have that patient experience, so you don't have to worry about seeing your first patient in a hospital or in a clinic. So you're already prepared for that as well.
I feel like practicum is a unique feature of Clarke. I'm not sure how many other PT programs implement practicum, but it's basically a pro bono clinic that we do here at the Kiel Center, and we also have some local off-site places where we go to like Oak Park Place, or we work with some like retired nuns. So as a first year, practicum is second semester, and I worked under a second year who was my CI, and they kind of mentored me as I worked with patients. And then now as a second year, first semester, we had practicum where it was just us working with patients, and now into second semester, we are mentoring the current first years, and they're taking over working with patients, and I kind of just step back and interject when I feel like I need to, or if there's a teaching opportunity, I can step in. Clinicals are different than practicum because we are no longer in school, so we are either on like summer break or winter break, and we're expected to know certain skills. So our CIs offsite are given a list of skills that we should know how to implement, and then it's usually an 8-week rotation over the summer. In our second year, we have a short 4-week rotation that we do.
One thing that Clarke offers is they have a lot of different internships around the country, and so if you do want to get out after graduation, you have those opportunities because those internships, they might set you up for a job interview out there, or they might give you a good clinical instructor that can write you that letter of recommendation that gets you a job in an area that you're looking to get. And so it's something that you have the option to go out, but you also have the option to stay close to where you grew up or where you went to college, things like that.
I'm from Washington State, so they actually have sites in Washington State. They have some in Arizona and Florida. They have a huge bulletin board in the office with pins of all the sites they have. It's kind of incredible how many sites that we can go to. So this summer I'm actually going to Arizona for a site, so that will be exciting. I think it's just a great opportunity to implement our skills while we're learning them in practicum, and then when we move into our clinicals, we kind of have built up that patient experience, and I just think we're more confident going into those clinical experiences because we've already had that patient interaction instead of just kind of going in with no experience at all. Self-care is very important, but now I've just kind of found a balance, and taking the time to make dinner and exercise has been very helpful with stress management.
One thing that I do for stress, kind of getting away from school, is just be able to work out. Obviously being in the field, you understand how important and how great that is for your health, but I think it's just a great way to just kind of leave school in the background and just be able to work on things that you want to do for yourself. Being in the graduate program, obviously the level of your curriculum is going to be a lot higher, but at the same time, it's something that you'd like to do, so it sparks more of an interest. And so one main important thing is just to be able to use your time wisely.
It's good to get to know your cohort well, and my class is pretty tight-knit, and I think being able to lean on each other and use each other as resources has been super helpful inside and outside of the classroom. I think it's really important to realize that you're here, you're in PT school, so it's no longer a competition, and you're kind of just all in it together, and just building that relationship I think is super important. I have really enjoyed the Dubuque area. I come from a really small rural farm town, so even though Dubuque is a smaller city, I've still enjoyed it. My husband and I live walking distance of the river walk, so we can go down to the Mississippi. We have a dog that we can go walk down there, and all the local parks and the cathedrals are beautiful to just go walk around and look at. Restaurants downtown are really nice. I love trying new foods, and so it's fun to go pop around the restaurants, and the boutiques in the area are really fun to go look at. So I think practicum has really prepared me to be in the clinic and working with patients. I definitely feel like sometimes not knowing all the skills going into practicum is frustrating, but being able to learn those skills and implement them as I go has been very helpful, and I feel like I'm getting what I need to out of this program to be successful as a PT, and I feel like myself and my classmates will be successful going into boards.
Clarke does a very good job of preparing you for graduate school with your prerequisites that you have. Anatomy and physiology is a really good one. That the things that we learned here at Clarke are things that outside students might not learn in their curriculum. So when you get to the graduate level and you're being thrown more at you, you're able to adjust because you've already kind of talked about that stuff, maybe not in as much detail, but still fresh in your mind. And the other thing is that being that it has a 3+3 program, there's a year that you're saving there, which is really important and really beneficial in the future. I am only going for 6 years for my degree. It may seem like I'm losing a year, but in reality, you're just taking what you're already doing and you're just combining them. So the biology classes that you would take in your undergrad, you're just taking your senior year, which is also your first year of the PT program. And so you're really not losing any education in the process, you're just being able to be out in the field 1 year sooner.
In about 1 year I'll be graduating, and my plans are to move back to Washington State. I so far have really enjoyed my time here in Dubuque and going to Clarke. I've made some really great relationships with my classmates, and I can see myself coming back in the future.